are you ready to do that?
Geneva can do the roll call.
Okay, great.
I take that back. I'll do the roll call. Sorry. Sorry about that.
I'm here.
Okay, Representative Fay. Excuse me. Representative Fay. Not present. Representative Frame.
Present.
You get two. She gets two people present.
Senator Hasagawa.
Here.
Representative Hoff. Representative Kilduff.
Present and good morning.
Good morning. Representative Kraft. Not present. Senator Mullet.
Here.
Representative Orcutt.
Is here as well.
Representative Paulette.
Here as well.
Senator Saldana.
Present.
Senator Short.
I'm here.
Representative Stokesbury. Not present. Senator Taco. Not present. Senator Wagner.
Present.
Senator Wilson. Not present. Okay, that concludes our roll call.
And so the first item of committee business is a motion in order to approve the September 30th JLARC meeting minutes. I would entertain a motion.
So moved.
Second.
There's Representative Orcutt has moved. There's been a second, and I think we'll do another roll call of the votes to approve the minutes.
This will be the roll call to approve the minutes for the September 30th meeting. Senator Fay is not present. Representative Frame.
Aye.
Senator Hasagawa.
Aye.
Representative Hoff. Is not present. Representative Kilduff.
Aye.
Representative Kraft.
Aye.
Senator Mullet.
Aye.
Representative Orcutt.
Aye.
Representative Paulette.
Aye.
Senator Saldana.
Aye.
Thank you. Senator Short.
Aye.
Representative Stokesbury. Not present. Representative Taco.
Aye.
Excuse me, Senator Taco.
Still aye.
Senator Wagner.
Wagner votes aye.
Senator Wilson.
Can you hear me?
Yes, Senator Wilson, your aye. Thank you. The ayes have it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 ayes.
So the minutes are approved. Our first presentation today is, I don't know whose feedback that is. Is anybody on? Well, that's my feedback, is it? Can you tell, Keenan, where it's coming from?
I think it's coming from Senator Wilson there.
Oh.
I'm trying. What's going?
I think.
Saldana also serving as tech support. That's impressive.
Yeah, I think Senator Wilson, you accidentally have two connections to the meeting, so that's probably what's going on.
Okay, I think it's gone away. So the first presentation is wildfire prevention, preparedness, and expenditure review of the preliminary report. And I think from JLARC staff we have Casey, Rebecca, and Susanna. I think we're going to do the report.
Senator Mullet, this is Keenan, if I may, can I make a quick brief announcement before we start on
please.
the
Yeah.
JLARC peer review?
Yeah.
Yeah, I just wanted to let the committee members know that under audit standards, the JLARC staff have to every 3 years undergo an external peer review. That's to help confirm our compliance with the audit standards and give all of our audiences and primarily all of you members an assurance about the quality of the work. I'm pleased to report that we got a sterling review by the review that was conducted. It was done remotely, of course, in the environment we're in right now. The National Conference of State Legislatures helped coordinate the review. We had external experienced executive management staff that work in audit and evaluation work from some of our colleague offices in New Mexico and Montana. They spend about a week of their time digging through all of our processes, talking to stakeholders. They interviewed the executive committee, and they really put us through the ringer and reviewed all of our supporting documents. And I was very pleased that they gave us a good stamp of approval. They said the full peer review report will be posted on the website, so anybody wants to see the actual document itself, it'd be great. But there's a couple notable items I'd like to point out. They said JLARC is an effective performance audit organization overseen by an engaged joint legislative committee. We have a collaborative work environment where management and staff work together to ensure the products are of the utmost quality, and that JLARC is an organization with a group of experienced and well-educated analysts with deep and diverse skill sets suited to their work. So I hope that gives everybody an assurance that we're doing the best we can and doing of the utmost quality to be objective and evidence-based to help you with all your work in legislating. And if anybody has any questions, happy to entertain them. And of course, please feel free to look over the peer review report.
And members of the committee should know, I did just ask them anecdotally, just out of curiosity, where they would rank JLARC out of the other 50 states. And they were very quick to respond. They put us in the top 10%, they said. They fear we're always one of the top 5 states in terms of having a process like we have here in terms of getting independent evidence-based information to help us make decisions. So I felt much better knowing that. So I've learned something new every year. It's good. Okay, with that, we can, unless there's any other questions, yes, we can give them applause to the excellent staff at JLARC.
Thank you, everybody.
Okay, we can go ahead. Wildfire prevention. And just so people know, I just never hesitate to ask questions as we go. You know, no reason to wait till the end. I feel the more interactive presentations are, the more engaged people are. So feel free to ask questions as they go.
Can you see our slides okay?
Mm-hmm.
Great.
And you can hear us?
Yes.
Good morning, Chair Millett, members of the committee. My name is Casey Radistitz, and I'm joined by my colleagues, Rebecca Connolly and Susanna Pratt. We're staff to the committee and here to present the preliminary report for our review of DNR's wildfire prevention and preparedness programs and expenditures. The legislative auditor concluded that DNR's long-term approach to prevention and preparedness is supported by science and best practices. The approach requires coordination with other entities and may reduce fire severity, which can impact costs to suppress fires. The legislative auditor did not make any recommendations in this report. In 2019, the JLARC committee directed us to review DNR's wildfire prevention and preparedness programs and related expenditures, and at the same time to identify whether there is evidence that prevention and preparedness activities can reduce the impacts and costs of wildfire. You also asked us to follow up on DNR's progress implementing the recommendations from our 2018 Wildfire Suppression Funding and Costs report. Those recommendations instructed DNR to improve its fire suppression data collection and reporting. And we did follow up, and DNR reported that they are still in the process of implementation. Our presentation today will be divided into 3 parts. First, Susanna will discuss DNR's long-term approach to prevention and preparedness, and this includes their plans and spending. Then Rebecca will explain how DNR coordinates with partners to achieve prevention and preparedness goals. And finally, I'll describe the results of our literature review about the effects of preparedness activities on fire impacts and costs. And I'll now turn it over to Susanna, who will start with DNR's plans.
Good morning. My name is Susanna Pratt. I'm staff to the committee. The next few slides will go over DNR's plans and activities related to fire prevention and preparedness. In recent years, DNR has developed long-term forest health plans as required by state and federal law. It's also developed a 10-year plan to address wildfire. These plans were written in 2017 and 2018, and they have 10 and 20-year implementation timelines. This means that DNR is still in the early stages of implementing its plans. Collectively, these plans set forth strategies and goals related to wildfire prevention and preparedness.
Can I ask, is it a 10-year, 20-year timeline because of budgetary constraints, or you physically can't do the work quicker, or what's the sense, I guess, on that? Or is that hard for you guys to speak to?
The Forest Health Strategic Plan was designed to be a 20-year plan with a 20-year implementation timeline, and the Wildland Fire Protection Strategic Plan was designed with a 10-year timeline.
But were those timelines created because of budgetary reasons, or was there other reasons that created those? I guess, like if people wanted to speed it up, I guess would be the question. Or is it hard for you guys to speak to that?
It may be difficult for us to answer that question. DNR staff are on the call today, and they might be able to provide a little more
We can
insight.
hold that for later. Okay, go ahead. Sorry.
Thank you. DNR is still finalizing its formal definitions for prevention and preparedness. So our report will use the following definitions. Prevention refers to activities that are aimed at reducing the number of human-caused fires. And this includes things like public education, fire danger ratings, and burn bans.
One second. Senator Hasagawa, do you have a question? I see your hand raised. Sorry.
Yeah, thanks, Mr. Chair. I was just curious as to whether those plans that you were talking about take into account the increasing frequency and severity of the fires that we're facing, and whether they're adequate to address those.
That sounds like those could both be questions. I think Lauren and Jennifer are here, so we may have them pop on after the presentation from DNR, maybe. So Lauren, you heard Senator Hasagawa's question, so maybe we can just make a note to address those, I guess. So I'm guessing that's better for them to address than.
Okay, thanks.
Sure. For our report, preparedness refers to activities that are intended to improve forest health and help communities adapt to human and natural-caused wildfire. This includes forest health activities such as thinning and chipping trees and prescribed burning, and community preparedness activities such as planning and creating defensible space around structures. For our report, preparedness does not include suppression-related activities that extinguish or control the spread of wildfire. DNR's forest health and wildfire plans identify strategies and actions that are consistent with those that are identified in national guidance. The National Cohesive Wildland Fire Management Strategy is a federally mandated strategy developed in 2014. It provides guidance for fire prevention and management approaches nationwide. The National Cohesive Strategy has 3 goals: to restore and maintain resilient landscapes, to create fire-adapted communities, and to respond to wildfires safely and effectively. DNR's wildfire strategy adopts these 3 goals, and it adds a 4th one: to create capable, integrated, and sustainable wildfire preparedness, response, and recovery systems. As I mentioned earlier, DNR is still in the early stages of implementing its long-term plans. In addition to mandating a forest health plan, state law also requires DNR to assess and treat 1 million acres of forest land in eastern Washington by 2033. DNR has begun to meet this requirement by identifying priority areas for forest health treatments. 33 areas have been identified so far, and they are shown on this map in yellow. DNR identified these areas using data for fire risk, wildland-urban interface, drinking water, wildlife habitat, climate change, timber volume, and aquatic resources. DNR conducts evaluations of each of these areas to identify the specific actions that are needed to move the landscape into a more ecologically resilient condition and reduce the fire risk. This work is ongoing, and DNR plans to identify new priority areas and conduct more evaluations each biennium as directed by state law. DNR has spent a total of $70 million on preparedness and prevention activities in fiscal years 2018, 2019, and 2020. Of this, $63 million was spent on landscape preparedness activities, such as forest health treatments and fuel reduction projects. DNR uses unique accounting codes to differentiate prevention and preparedness spending from its other activities, including wildfire suppression. The codes also provide details about its spending, such as the type of activity, specific project information, and the region where the funds were spent. And our report includes an appendix with detail for fiscal year 2020. While we can identify how much DNR has spent overall on prevention and preparedness, DNR cannot systematically show how much it has spent on forest health in its priority areas. DNR maintains both financial data and spatial data for forest health treatments. The financial data includes the fund sources, project names and codes, and the amount that DNR has spent. The spatial data includes project locations, the types of treatments, and the number of acres that were treated. These two data sets do not currently link, which means that DNR currently cannot report the cost of treatments at specific locations or know whether its spending is consistent with its plans and goals. DNR reports that it is working to correct this problem and has proposed data standards to link these two data sets using a common unique identifier. And in a few minutes, Rebecca will discuss some of DNR's additional data tracking efforts.
Good morning, I'm Rebecca Connolly, and in this next section, I'll explain how DNR coordinates with landowners and other stakeholders to achieve its prevention and preparedness goals. There are 22 million acres of forest land in Washington. Collectively, federal, tribal, and private landowners own more than DNR. These landowners may prioritize their objectives differently. For example, some might emphasize timber revenue or recreation opportunities. As Susanna explained, DNR has established 33 initial priority areas for treatment. On the map, the dark blue represents land that DNR owns, the light gray represents federal land, and white is other ownership, such as tribes or private landowners. The priority areas are shown with a yellow overlay, and you can see that they cross the ownership boundaries. There are 3.8 million acres within the priority areas, and since DNR owns or manages only 500,000 acres within these areas, it will need to work with others to accomplish the legislature's goal of treating 1 million acres. DNR and federal agencies use formal agreements like the Good Neighbor Authority to coordinate landscape preparedness. Under this agreement, federal agencies can reimburse DNR for forest health treatments that it does on federal land. Federal and state agencies, tribes, conservation groups, and others work through forest health collaboratives to reach non-binding agreements about how federal forest lands are going to be managed. And DNR also offers financial and technical assistance to private small forest landowners who want to improve forest health and resilience to wildfire. Other agencies that work with small forest landowners include conservation districts, the U.S. Forest Service, and Washington State University Extension. As required by state law, DNR is developing a strategy to monitor the outcomes and effectiveness of forest health treatments. One part of this system is a tracking system. It will compile information from DNR and other state, federal, and private landowners.
Senator Short,
DNR began developing.
One second, Rebecca. Senator Short, do you have a question?
I do, but I can wait until she's done.
Okay.
DNR began developing this tracking system in September of 2018, and it currently plans to make it viewable on its website in 2021. The agency plans to include maps and information such as project descriptions, the treatment type, objectives, and a completion date. Wildfire prevention and preparedness also takes place in the Wildland Urban Interface, or WUI, and that's the area where homes are built near or among lands that are prone to wildland fire. Residents, government agencies, and private organizations share responsibility for prevention and preparedness in the WUI, and this is sometimes called becoming a fire-adapted community. For example, DNR and fire agencies offer wildfire prevention education and communicate burn restrictions. Residents can create defensible space and use fire-resistant materials on their homes. Conservation districts, fire agencies, and DNR all provide information and assessments. Local governments adopt and enforce building codes, including those specific to the WUI. And local governments also may develop a community wildfire protection plan to identify and prioritize local needs. There are usually many participants in developing the plan, including conservation districts, federal agencies, forest collaboratives, businesses, residents, and nonprofits. DNR, the local fire agencies, and local governments all must agree to the plan. And finally, groups called fire-adapted community learning networks and coalitions connect all of these stakeholders so that they can share best practices, resources, and lessons learned. Members include fire agencies, conservation districts, DNR, residents, and others.
Our study directive also required a review of research to identify whether there is evidence that certain types of activities can affect the impacts and costs of wildfire. To do this, we worked with 2 expert consultants and reviewed more than 300 peer-reviewed research articles, guidance documents, and published reports about fire ecology and management. The full bibliography is available in the appendix of our report. And in the next few slides, I'll give you an overview of what we found. Landscape preparedness activities, such as thinning, chipping, and prescribed fire, can reduce fuels on the landscape. And while the goal of these activities is not to stop all fires, they can change how a fire behaves when it encounters a treated area. And here's a quick, very simple example of how it can work. Before fuel reduction takes place, the forest is densely packed with trees, brush, and surface fuels such as plants and wood debris that line the forest floor. When a fire occurs, it can travel from surface fuels through ladder fuels and into the forest canopy. And this high-intensity fire can then spread through the forest canopy and leave the forest severely damaged. After fuel reduction activities, there are fewer surface fuels, and the distance between trees and from the forest floor to its canopy is increased. When a fire occurs in this area, it is more difficult for it to move into the forest canopy, and this means the fire burns at a lower intensity and the forest is less damaged. The research we reviewed is generally applicable to forests in eastern Washington. It suggests that fuel reduction projects are most effective at reducing fire intensity and severity when they combine forest thinning and prescribed fire to reduce surface fuels. As an example, the picture on screen is from the Sinlahican Wildlife Area. It shows an area that was partially treated with prescribed fire. And when the Limebelt fire burned through this area in 2015, the side that had been treated with prescribed fire burned with less intensity and the forest was less damaged. We would also like to note that while prescribed fire is a best practice, it may not be appropriate for all forest types or conditions. We found that researchers typically use complex computer models to evaluate how fuel reduction activities may affect individual fire costs. These models estimate how fuels may affect fire growth, behavior, and size. And this information is then used in another model to estimate the subsequent effect on suppression response and costs. Overall, the research using this approach suggests that preparedness activities that reduce fuels may lower suppression costs for individual fires if the fire occurs in a treated area. While the research I just mentioned suggests that preparedness activities may reduce costs for individual fires, the relationship between spending on preparedness, prevention, and suppression is very complex. It cannot easily be summarized into a simple equation. There are many factors that influence suppression costs, such as fire size, weather, and development in the wildland-urban interface. Some of these factors are related to prevention and preparedness, and some are not. This means it's challenging to definitively predict how much DNR's preparedness activities will reduce overall costs.
To recap our presentation today, the legislative auditor concluded that DNR's long-term approach to wildfire prevention and preparedness is supported by science and best practices. The approach requires coordination with other entities and may reduce fire severity, which can impact the cost of suppressing fires. And the legislative auditor did not make any recommendations. We will be
short. Oh, go ahead. No, sorry, you can finish. Sorry.
We'll be back in January to present our proposed final report. And our contact information is here, and we're happy to answer any questions.
Senator Short, why don't you go ahead?
Thank you, Mr. Chair. Really appreciate that. And this may be something that DNR needs to answer and not staff. I wonder why wildfire suppression wasn't included in the prevention preparedness pieces, whether or not that's a reflection of how the agency treats that, and why it wouldn't be included.
Do we want to just have Lauren and Jennifer? Is it better, I guess, Casey, then Rebecca, to have Lauren and Jennifer answer some of the DNR questions?
I'll defer to staff, but I'd be happy to take those.
Okay, why don't you go ahead, and then we can answer the questions that have been asked, and then we'll go to Representative Kraft. Go ahead, Lauren.
Yeah, and thank you, Chairman Mullet. Also, my colleague Jennifer Watkins is on the call as well, and she may answer some questions as well. Thank you for inviting us to attend. To Senator Short's question, again, I'll defer to JLARC staff to answer the question about how they designed that. But from the agency's standpoint, those are separate sort of approaches or activities. Suppression would be itself an activity, and prevention and preparedness would be something that occurs prior to an incident where we'd be doing suppression.
Can you speak, Lauren or Jennifer, to Senator Hasagawa's question earlier?
And that was, yeah, about the tenure, the difference between the climate.
I think Senator Hasagawa's was based on, was this plan been updated based on the fact that we seem to have more intense fires with climate change?
Yeah, obviously the forest health, 20-year forest health strategy came first for the agency, and the driver behind that was an attempt to, over that period of time, start to bend that curve in terms of catastrophic wildfire. And I think subsequent to that, the legislature made it clear that that was the intent of the forest health strategy, was to reduce the incidence of these uncharacteristic wildfires that we're experiencing throughout the West. And also the 10-year wildfire strategy took that into account as well, that those strategies were designed to address an ongoing or inclining occurrence of catastrophic wildfire. So in both cases, that was accounted for.
Okay.
And
so,
Lauren, this is Jen. Is it okay if I build on Lauren's just briefly?
Yeah.
This is Jen Watkins with the Department of Natural Resources, and just building off of Lauren, that both of those plans did inherently embed that we are experiencing, greater intensity in wildfires. They also built in that we actually step down into those priority areas that was mentioned during the presentation and do an analysis there that guides exactly where we need to be treating and how we need to be treating, which lets us bring in the greatest available science every time we step down, which lets us bring in that finer scale data and understand how those fires are interacting on that landscape And we also reflect on the changed conditions, including what has happened every time those fire seasons have occurred every couple of years. And so it's an iterative process. We not only brought in what we knew when we wrote the plans the best we could about climate change and what we're experiencing with wildfires, but we built in a process to keep bringing in that information.
Okay, we're gonna go to Representative Kraft and then Senator Wagner. Senator Short, did you still have a question, or was that, you're good? Okay, so we'll go to Representative Kraft and then Senator Wagner.
Thank you, Mr. Chair. Just a quick question. Back at the beginning of the presentation, if I understood correctly, I thought I heard JLARC say, and this is for DNR, but I thought I heard JLARC staff say that basically that DNR is still in the process of defining what prevention and preparedness is. And I find that astounding. If I guess the question is that true? Because if you can't even define it, then you're not ever going to be able to build a proper plan or solution toward that. So can you help answer the question? I mean, do you have a definition of that? The JLARC obviously built one, so it can't be that difficult. I'm just curious.
Yeah, thanks for that question, Representative. The issue is we interact with a number of different agencies and organizations that all have different definitions for that. And what DNR, from DNR's perspective, when we hear we're continuing to do that, we're trying to align as best we can those definitions with other organizations. And currently we're going through a process of a report back to the legislature on spending in the wildfire program. And as part of that, we're continuing to refine those definitions. DNR has always had definitions for those. And in some cases, they're not the same definitions, and these may go back decades. Readiness, for example, where DNR uses that term for preparedness, it means the same thing generally to most organizations, but it's not the current nomenclature in many cases that other organizations use. And what we're trying to do is align that. I hope that helps.
Okay, Senator Wagner.
Yeah, so no recommendations. That's the JLARC equivalent of an attaboy or thumbs up. But is DNR satisfied that this is the best they can be? And if not, what more do you need to get better?
So I think we're always looking to improve. This is a very serious issue that's obviously impacting citizens all over the state of Washington, both in Eastern Washington and Western Washington, and that's going to continue for a while. We're going to have these fires that are uncharacteristic, but like I said earlier, we're trying to bend that curve. We want to get better at tracking where our projects are. The staff had pointed out that in some cases that we have spatial data, we have the tabular data, and we need to do a better job of linking those. We recognize that that's important to do to ensure that you have the best information for that as well. I think the other things that we need is continued support to carry out these activities, both in forest health and in wildfire, that we know based on the plans that we've written, and again, they're based on the best available science, that if we continue to do those kinds of activities, we're going to, over time, turn that. It's, as the staff mentioned, in some cases it's difficult to find a direct correlation, but I think empirically, with a number of experts all across the nation in terms of looking at this, the more we can reduce those forest fuels, improve the health of the forest, be prepared to meet wildfire with the resources necessary to do that, we can make a change and do it over time. So
I guess sorry, Jennifer, Jen, did you have something you wanted to add? Okay, and so I guess Lauren or Jen, on the idea, were those times picked, the 10 and 20 year, based on saying this is kind of what our budget is and this is how we phase it in? Or if Like, could it be
Yeah.
accelerated, I guess, is kind of.
I think what we were looking for, Senator Mullet, was an opportunity in the wildfire side of it, or in that strategic approach, is to accelerate as much as possible the notion of doing the work necessary to begin to bend that curve and reduce the wildfires. This issue has taken 100 years to get here, and we want to move as quickly as we possibly can to reverse some of those environmental or ecosystem conditions that lend themselves to these large catastrophic wildfires. And Commissioner Franz wanted to accelerate that, and that's why you end up with a 10-year strategy for wildfire.
Okay. Unless there's any other questions for Casey.
Mr. Chair,
Representative Burkhardt, go ahead.
Thank you, Mr. Chair. I have my hand up, but I know sometimes when you're looking at the screen, you can't see everybody.
You were not on the screen, I know. Sorry, I missed you.
That's okay. So my question, you mentioned in the report, the technical assistance to landowners. And I just wondered if you could elaborate a little bit more on what is available in money for technical assistance. And is that strictly for writing prescriptions, or does it actually help in carrying out the prescriptions? In other words, funding to actually implement the projects. I'm hearing from landowners that there's not enough money for technical assistance, and they're constantly requesting the legislature fund that at a higher level. Can you talk about what the level is and what you perceive the need or demand out there for it?
Well, I'll let Jennifer take a run at that. She's in the program directly, and I'll let her take a shot.
Sure. There's two primary programs in our Forest Health and Resiliency Division that provide that technical assistance to small forest landowners. One is our Forest Stewardship Program that's largely funded out of federal dollars from the U.S. Forest Service. And that doesn't fund project implementation. Instead, that actually funds the ability of one of our foresters to visit with a landowner and write a long-term forest management plan and help them monitor that for their property. And so helping them understand and walk their property to know what will it take to manage this forest to meet your goals and keep it healthy, and be able to get a shared vision for that, document it, and help them understand the resources and needs they'll have. And so that's just really a planning document. Then we also have landowner assistance. And that's where we have foresters who not only come out, often very based on kind of a fuels reduction motivation, and work with the landowner to develop that plan for a piece of their property. How do they live with fire on the landscape, reduce the risk to their home? But then that's also associated with funds that are provided by the legislature for that implementation, a cost share implementation of that project. So they develop the prescription, they develop that plan, and then they offer to work with them for a cost share for that implementation. That cost share has the state dollars associated with it. And then we can also bring in external resources like federal dollars, the sweat equity or cash from the landowner to actually act as that cost share. So there's several programs, and there's everything from just planning and providing a better understanding of your land and how to meet your goals and maintain your forest to meet those goals, as well as actually doing the implementation itself.
And staff pointed out that, we're going to have to work with other landowners to accomplish this in terms of the number of acres that you have all expressed that, is the goal. And so resources are always going to be a challenge. We want to have as many people involved in doing this, landowners, small forest landowners and others, to reach that goal. And so, again, resources will be a challenge.
So do we know how much that is? I mean, we know what the backlog is on FREP. Do we know how much unmet demand there is for the technical assistance?
Go ahead, Jennifer, if you've got an idea of that. We could get back to you as well, Representative, on that.
I was going to say, we could get back to you. I just would confirm that we heard the same thing developing our latest Forest Action Plan revision this year, that there is a tremendous backlog. Not only what's easy to quantify is the acres to be treated and what that would look like, but just from landowners wanting greater technical assistance from programs like that Forest Stewardship to better understand their land and how they themselves can manage it with their own resources.
Okay, well, thank you very much. I really appreciate it. Casey, Susanna, Rebecca, and Lauren and Jennifer, thank you for being on to answer questions.
Yeah. Thank you.
Now switching from our forest to regulation of ambulatory surgical facilities. This is the beauty of JLARC. You cover a wide variety of topics. And this is going to be Pete Van Morsel, Amanda, and Scott. I think we'll do the preliminary report.
Yes, good morning, Mr. Chair and members of the committee. My name is Amanda Edrick, and I'm joined by my colleagues Pete Van Morsel and Scott Hancock. And today we are presenting the preliminary report of the regulation of ambulatory surgical facilities. And the legislative auditor's conclusion is that the Department of Health has not met its goal for how frequently it performs state licensing surveys of ambulatory surgical facilities. It is unclear how this affects patient safety. The department should determine a survey frequency goal based on patient safety risks and ensure license fees are aligned with that goal. The legislature directed JLARC to review the department's ambulatory surgical facility regulatory program in the 2019-21 operating budget. The bill directed JLARC to compare state and federal ambulatory surgical programs, including survey requirements, survey processes, and program costs. The bill also directed JLARC to review the Department of Health's licensing fees as they relate to program costs, staffing, and survey capacity. This presentation has 4 parts, and I'll begin by discussing the review's comparison of the state licensing program to the federal certification survey program. The rest of the presentation will focus on the state licensing program. Scott will review the department's survey program goals and performance. Then Pete will discuss the state licensing program's efforts to increase survey capacity and the program's inspection and licensing data. So I'll begin with the comparison. In 2007, the legislature required the Department of Health to establish a licensing and inspection program for ambulatory surgical facilities in Washington. The program began in 2009. An ambulatory surgical facility is a medical facility whose primary purpose is to provide outpatient surgical services. Outpatient surgery is when a patient is discharged within 24 hours. Examples of surgical specialties include orthopedics, plastic surgery, endoscopy, and eye surgery. The Department of Health administers 2 programs for ambulatory surgery, a state licensing program and a federal certification program, which are separately funded and accounted for. Ambulatory surgical facilities must be state licensed to operate in Washington. Providers of ambulatory surgery must be federally certified if they wish to receive funding for eligible Medicare and Medicaid patients. Each program has its own health and safety standards. For the state licensing program, these are established by the Department of Health. The Centers for Medicare and Medicaid Services establish these standards for the federal program. To evaluate compliance with these standards, each program performs inspections, otherwise known as surveys, of the facilities. Surveys for both programs are performed by the Department of Health staff. The cost of these surveys is paid from different sources. The state licensing program is statutorily required to be 100% fee supported. The department establishes the fees, and facilities pay the fees to the department every 3 years. The federal certification program is funded through an agreement with the Federal Centers for Medicare and Medicaid Services. There's considerable overlap between the state licensed and federally certified facilities. Of the 186 state licensed ambulatory surgical facilities, 130 are also federally certified. Facilities may also be subject to a 3rd type of survey. They may elect to be accredited by an approved accrediting organization. To do so, facilities must pay a fee and undergo a survey performed by the accrediting organization. As we'll discuss later, accredited facilities pay a lower state license fee and are subject to less frequent state surveys. But because the department does not perform accreditation surveys, They are not a part of this review. When we compared the state and federal survey regulations and processes, we found that they were similar. Both sets of regulations cover similar regulatory areas such as infection control and patient rights, and the regulations do not contradict one another. Inspectors have the same position title and same professional qualifications. The department follows the same survey procedures for both programs. This entails visiting a facility on site, observing patient treatment from admission to discharge, and writing a statement of deficiencies after the on-site visit, and then approving a plan of correction by the facility. We found that state surveys are on average shorter than federal surveys, in part because federal surveys are more frequently require a follow-up visit. We also compared Washington federal survey length with other states' federal surveys and found that they are similar. The rest of the presentation will focus on the department's state licensing program. Next, Scott will discuss the department's survey frequency goal and the number of surveys it has performed.
Well, we found that DOH's survey frequency goal is not based on a demonstrated link between survey frequency and patient safety outcomes. Statute sets a maximum frequency at which a facility can be surveyed. If the facility is only state licensed, it can be surveyed no more frequently than once every 18 months. And if a facility is state licensed and federally certified, or state licensed and accredited, it can be surveyed no more frequently than once every 36 months. DOH has determined that it should survey as often as statute allows. And given the current number and the composition of licensees, this results in a need to perform about 77 licensing surveys per year. DOH notes that this goal is based on prior statutory requirements, which were similar to those for acute care hospitals. And although the survey frequency goal determines the annual workload for the program, DOH has not demonstrated that this goal is optimal for protecting patient safety. We also found that DOH has not met its state licensing survey goal. In this bar chart, we're portraying the number of state licensing surveys performed each fiscal year. The dotted line at the top of the chart indicates the 77 surveys per year that are implied by the department's survey frequency goal. And in recent years, the department has averaged about 9 surveys per year. This has resulted in a scenario where, when measured against the department's survey frequency goal, 71% of facilities are more than 1 year overdue for a survey. The table on the screen shows how the 186 facilities are distributed in this backlog. The bottom row indicates how many years overdue the facilities are, and the top row indicates what share of facilities fall into that group. As you can see, 71% of facilities are more than 1 year overdue for a survey. And as I previously stated, it's not clear whether meeting this goal affects patient safety. Although 71% of these facilities are more than 1 year overdue for a survey, we note here that 170 of the 186 facilities are also subject to federal certification or accreditation surveys. DOH performs federal certification surveys on behalf of the federal government, and DOH has consistently met the performance targets under that program. Additionally, accreditation organizations perform their accreditation surveys typically once every 3 years. This leads us to the first legislative auditor recommendation. The legislative auditor recommends that DOH identify how the frequency of licensing surveys is related to risks to patient safety, and that DOH determine a survey frequency goal that is based on those risks. Now I'll turn things over to my colleague Pete, who will discuss the department's surveying capacity.
To increase survey capacity and reduce the backlog, the Department of Health raised licensing fees in 2019 so that it could employ more inspection staff. Again, fees are paid every 3 years, and the amount of the fee is determined by a facility's annual surgery volume, as well as its federal certification or accreditation status. Facilities with a higher surgery volume are charged higher licensing fees. And facilities that are also federally certified or accredited are charged lower fees, as these facilities are subject to less frequent state licensing surveys. The 2019 fee increase ranged from 170% to 263%. Prior to the increase, the fees were ranging from $3,600 to $10,000 every 3 years. And the current fees are $12,900 to $27,000 every 3 years. When it set fees in 2019, the department's assumptions did not match prior program performance. It estimated that surveys would take, on average, 40 staff hours each, and that one inspector FTE could perform 36 surveys per year. Thus, it estimated that it would require 2.1 FTE to perform between 75 and 80 surveys per year. However, between fiscal years 13 and 19, the average survey length was more than 48 staff hours, and each inspector FTE averaged 24 surveys per year. This indicates that at the budgeted 2.1 inspector FTE, the program would have capacity for approximately 50 surveys per year, which is short of the department's goal. So in 2020, DOH plans to raise inspector staff further to meet this survey goal. It will employ 3 inspector FTE, which is above the staffing level assumed when it set fees in 2019. And while the department could meet its survey goal with that staffing level, by doing so, the additional staff would result in a program cost in excess of license fee revenue. By doing that, the department risks not complying with the statutory requirement to set fees at a level that covers program costs, and also not complying with its own policy to maintain a reserve fund balance equal to 3 months of operating expenses. So unless the department reduces survey frequency, shortens the length of its surveys, increases license fees, or performs some combination of these 3 policy options, it risks a revenue shortfall and a negative reserve fund balance. And at this point, we do note that the department is statutorily prohibited from increasing license fees before July 2021.
I asked a math question, I guess.
Yes.
So if the goal, I mean, could they do like 40 to 50 licenses a year or not? I mean, is that, and if it just seemed like based on the average, when I was thinking about the math of $10,000 to $27,000 per thing, it seemed like they would have enough money to pay for 3 FTE. What am I doing wrong in the math? Or is that a question for them?
We can attempt to answer that question, and the department may be able to supplement that. But given the composition of the facilities, not every facility pays the fees at the highest level. There are few facilities, if any at this point, and this can fluctuate some, that are both performing 5,000 or more annual surgical procedures and are state licensed only, and that would put them in the highest fee category. So the department estimates total revenues based on the current composition of licenses by reported surgery volume and its certification or accreditation status. Based on that composition, it estimates for the next 3 years when these facilities will pay their license fee, and that will generate a revenue estimate for that 3-year period. It then budgets its expenses based on that available revenue and based on its inspection goal. And the 3 FTE level is just over the revenue that would be collected for that 3-year period.
Okay. Senator Short, do you have a question?
Thank you, Mr. Chair. Appreciate that. And if you can't answer it today, just looking at it and getting back to us is fine. But I'm wondering, the intersection of, say, a survey that's done by the federal government versus the things that are in a state survey, and whether or not there is overlap. I do get it if you're only a state-run facility. I do understand that being different. But I'm wondering if there's overlap just in terms of what both the state and federal government look at, you know, in terms of these surveys. And so if you can answer it, great, but if not, you know, can certainly be free to follow up.
Senator, yes, there is certainly overlap. One major piece of overlap is that the federal regulations, called the conditions for coverage, include also compliance with state and local regulations. And so to be federally certified, a facility must comply with state and local regulations as well. So there is certainly overlap. And our review found that there is, that the regulatory areas, even when a facility is not also certified, the regulatory areas for the conditions for coverage at the federal level and the Washington Administrative Code at the state level are fairly similar and do not contradict. They are, in fact, covering similar areas like infection control and patient rights, et cetera.
And if I may, Senator Mullet, to just add to that, if that's okay. This is Keenan, Senator Short. But one thing I want to make sure that wasn't lost, or that you hadn't missed in the discussion too, is in cases where they're subjectable federal and state surveys, recall that they only have to do a state survey every 36 months, as opposed to state only, it's every 18 months. So part of that's the recognition that there is some overlap in the processes. So they allow them to go for a longer time if they're receiving a federal certification process.
Representative Kildall, do you have a question?
Yes, I did. Thank you, Mr. Chair. And just want to make sure I'm understanding the survey frequency issue and the goal that you mentioned, or that staff mentioned. So the DOH's goal, that's not set in WAC. That's just a department policy. Want to make sure of that. Is that correct?
That's right. There is a statutory limit on how frequently the department may inspect, and its goal is at that limit.
Right. And if I just may follow up, Mr. Chair, briefly. So the legislature in 2016 amended the ASF statute, and it said essentially a ceiling. So there's no floor, correct, for DOH. There's no statutory minimum. There's just there's a statutory ceiling, essentially, right?
Yes.
So conceivably, if the legislature did direct the agency to at least hit a certain minimum, that might be a more forceful or clear way, rather than just a chosen goal by the agency to conduct these surveys on whatever basis or frequent basis, correct?
Yes. There is no current minimum required frequency, and creating one would have that effect.
Thank you.
Representative Palat.
Thank you. I struggle to try to find where I should insert my questions on this, but my questions are in terms of the finding that about quality improvement linked to and health outcomes linked to survey frequency and survey content. There are a body of surveys for patient safety culture from the Agency for Healthcare Research and Quality and others by CMS, and those do have strong linkages to revelations about health outcomes. So I'm wondering why the state doesn't utilize that tool as part of the determination of where it focuses frequency of surveying, and why it doesn't include any of that apparently, and as I can tell from the audit, does it even include the patient safety culture surveys? We use surveys in different form. This basically, the state survey is a review of the facility, but it is not a survey of outcomes, is it?
Representative, I think if I understand your question correctly, the survey does in fact cover a or address the health and safety, the compliance with health and safety standards at the facility, including sort of physical condition of the facility, but also the practices performed within the facility. As to the department's use of the tool you mentioned, that might be to the
of the tool you mentioned.
To the department.
That may be to the apartment.
Oh, wait a minute.
Jeffco.
Buddy Keenan. I think Amy accidentally has her.
Yeah, I think our closed captioning person accidentally turned her microphone on. You could turn that off. That'd be great.
I'm sorry. Could you go back a step? And you're basically saying, if I understand, summarize and go forward, that you're doing a compliance inspection, essentially. We're calling them surveys. And then there are federal surveys about health outcomes and safety culture. And do we use that type of data at all in the state review?
Representative, I think that may be a question best posed to the department.
Okay. So let's, I'm sure the department's listening, and let's do that then.
And then, and it could be, we have a lot on our agenda today, so it could be one of the things where we might be able to give the department some questions to come back for the final review too. We'll see. Let's just see how we do on time. Let's keep, yeah, go ahead.
Okay, so to continue, this last slide leads us to Legislative Auditor Recommendation number 2. And that is that the department should follow its cost recovery policy and best practices by maintaining its reserve fund balance. And when it has determined the appropriate survey frequency and program level of effort, as implied by Legislative Auditor Recommendation number 1, the department should ensure that license fees and staffing are at the appropriate level to allow the department to meet this goal while maintaining its target reserve fund balance. The review also found that annual license fee payments may help to stabilize fee collection. As we mentioned currently, currently licensing fees are paid on a 3-year cycle. And because of when facilities were initially licensed, it turns out that the bulk of this revenue is paid in 1 year of this 3-year cycle. If you look at the bar chart, this occurs in fiscal year 21 when the majority of fees are collected. Because of consistent expenditures of the program, this complicates calculating the reserve fund balance in any given year. This also has the effect of taking 3 years for the program to fully realize any changes in license fees. So this leads to the 3rd legislative auditor recommendation, and this is a recommendation to the legislature that it amend statute to permit the Department of Health to collect ambulatory surgical facility license fees annually. And this could provide a revenue stability to the program and accelerate the impact of any license fee changes in the future. Finally, the last portion of the presentation will cover inspection and licensing data in the department's licensing and survey database. A review of this data found missing and inaccurate survey records in its licensing and regulatory data. And because the Department of Health relies on this data to prioritize ambulatory surgical facilities for a state licensing survey, it should take steps to ensure that the data is accurate and complete. Therefore, the legislative auditor makes a 4th recommendation. This is to the Department of Health, that it improve the procedures and data systems that it uses to collect state licensing and survey data. Once again, the legislative auditor's conclusion is that the Department of Health has not met its goal for how frequently it performs state licensing surveys of ambulatory surgical facilities, and it is unclear how this affects patient safety. The department should determine a survey frequency goal based on patient safety risks, and ensure license fees are aligned with that goal. This leads to 4 legislative auditor recommendations. The first is that the Department of Health should identify how the frequency of licensing surveys is related to risks to patient safety and determine a survey frequency goal based on those risks. Next, it should follow its cost recovery policy and best practices to maintain a reserve fund balance. The legislature should amend statute to permit the Department of Health to collect ASF license fees annually. And the Department of Health should improve procedures and data systems it uses to collect state licensing and survey data. That concludes our comments today, but as a reminder, this is the preliminary report. You'll hear from us again in January when we present the proposed final report, which will include the Department of Health's formal response. But members of the Department of Health staff are in attendance at today's meeting as well. And finally, this last slide shows our contact information and a link to the full report.
And I would say for members of the committee, just given time, we really want to make sure we get to the tax preference performance reviews, and we still have the one we have to vote on, which is the final report on alternative public works contracting. So I might suggest if we have questions for staff that we give them to them in writing, and then we can address them during the final report next month, if that's okay with folks. And that'll get us maybe back on schedule. That's okay. Thank you very much. I appreciate it, Amanda, Scott, and Pete. And for DOH staff, I know they were here, but we'll definitely make sure staff has a chance to comment on the proposed final. That's our practice. Thank you very much. Okay, so the proposed final report, alternative public works contracting procedures. We have Aaron and Melanie, I think. We've heard this preliminary in September.
All right, good morning, Mr. Chair, members of the committee. Can you see the presentation?
Yes.
Okay, great. All right, so my name is Melanie Stidham, and I'm joined by my colleague, Erin Cabin, and we are presenting the proposed final report on the sunset review of the alternative public works contracting procedures. And the legislative auditor has concluded that the legislature should continue the alternative public works contracting statute. The alternative delivery methods are widely used, and the Capital Projects Advisory Review Board, or CPARB, has created a forum for stakeholders to continually improve project delivery. We presented the preliminary report to you in September. This is going to be a much abbreviated version of that presentation that just focuses on our findings, and we'll try to leave plenty of time for you to hear from the agencies. And as a reminder, this is the second sunset review that our office has done on this statute. For a brief background, the Alternative Public Works contracting statute is codified in Chapter 3910 RCW, and it has 3 main components. It established the Capital Projects Advisory Review Board, or CPARB, to advise the legislature, and CPARB's membership includes representatives from the public and private sectors. Within CPARB, the legislature created the Project Review Committee, or PRC, to make decisions on public bodies' use of alternative methods. The Department of Enterprise Services provides staff support to both CPARB and the PRC. There are 3 alternative contracting methods that are within the statute. These are design build, general contractor construction manager, or also called GCCM, and job order contracting, which is sometimes called JOC. All public works projects have 3 basic steps, and these are planning, design, and construction. In the traditional contracting method, each of these phases is distinct, and the construction contractor is selected after the design has been completed by an architect or engineering firm. When GCCM is used, the public body is authorized to select the contractor while the design is underway, and this is often very early in the design process. And this allows the contractor to provide input on the design, including the constructability and cost of various design options. In design build, the public body holds a single contract with a design builder. And the design builder is a team between a construction firm and design firm, and this also allows the contractor to provide input into the design. And the third method of alternative contracting, job order contracting, is for smaller projects. And the public body selects a job order contractor to perform an undefined quantity of work for a period of 2 to 3 years. And as with the other alternative delivery methods, the contractor is selected based on qualifications and price factors. So with that overview, then this is what our presentation is going to cover for the rest of the time. And we're going to start with the use of the alternative contracting methods. So alternative methods are widely used in Washington, and this map shows the public bodies that have been approved to use design build or GCCM since 2013. Public bodies may seek approval to use an alternative method on an individual project, or they can seek certification to use the alternative method at their discretion for a period of 3 years. And so since 2013, the PRC has approved 179 projects and 38 applications for certification or recertification. And the projects in public bodies that have been certified to use design build or GCCM are spread across the state, as you can see on the map. And there are, in many of these locations, there are more than one project or certified body. Since 2013, those projects that have been approved by the PRC or reported to it by certified public bodies have totaled more than $23 billion. And school districts have made up the largest share with more than $7 billion worth of projects. And this is followed by transit authorities and universities. And among the alternative methods, thus far, GCCM has made up the largest share. And so I'll now turn it over to Aaron.
Hello, I'm Aaron Cavan, staff to the committee. Next, we will look at the membership and actions of CPARB. Statute established CPARB to evaluate public works contracting and provide policy advice to the legislature. And membership of CPARB and its committees includes a variety of stakeholders from the public and the private sectors. Statute directs CPARB to develop and recommend policies to enhance the quality, efficiency, and accountability of public works construction. And since 2013, CPARB has developed and recommended 5 bills, and there are 2 additional bills that were introduced that were based on CPARB's work. One example of a policy change coming from these bills is allowing public bodies to use GCCM on heavy civil infrastructure projects such as sewers, roads, bridges, and tunnels. CPARB has also studied and shared information about public works. For example, CPARB is conducting a study on local government public works contracting, which was requested in 2019 in ESSB 5418. Next, I'll briefly discuss CPARB's data collection for job order contracting. Statute requires public bodies that use job order contracting to report certain information to CPARB each year, and CPARB may also request additional information. DES staff are responsible for collecting the reports and summarizing them for CPARB, and there have been gaps in data collection and reporting and record keeping, including missing reports and incomplete or inaccurate reports. Also, CPARB does not use much of the data that it collects through this process. Overall, the statutory reporting requirements may not align with CPARB's primary duties of providing policy advice to the legislature. Finally, I'll briefly discuss the questions laid out in the Sunset Act. So the Sunset Act identifies certain key questions when conducting sunset reviews. First, has the use of RCW 3910 complied with legislative intent? Yes, CPARB engages stakeholders to make improvements to public works contracting, and the PRC maintains a thorough process to make decisions on applications to use design build and GCCM. Second, does the alternative process provide for efficient and economical public works construction with adequate cost controls in place? Yes. Stakeholders report that alternative contracting methods enable cost and schedule efficiencies, and they help public bodies identify and assess risks earlier in the project and mitigate those risks more effectively. Third, has CPARB achieved expected performance measures? Yes, CPARB has achieved its performance measures, which address its statutory authority and the sunset questions. For example, CPARB recommended policy changes and submitted requested reports to the legislature. Finally, what would be the effect of termination? CPARB and the PRC would be terminated, and public bodies would not be able to use design build, GCCM, or job order contracting unless they were granted their own separate authority to do so. Stakeholders that we interviewed opposed termination, and they reported that termination would likely lead to more disputes, more lawsuits, more change orders, more design and construction uncertainty, greater risk exposure, slower construction, and more expensive or lower quality projects.
And Aaron, the sunset is June 30th, 2021, is that right?
That is correct. And the legislative auditor makes 2 recommendations. The legislature should continue the alternative contracting methods in RCW 3910. And CPARB should evaluate which job order contracting data it needs to perform its functions and propose appropriate modifications to the legislature. CPARB and DES concur with both recommendations. And as with all of our studies, the Office of Financial Management was given an opportunity to respond, and they have no response. And our contact information is available here, and we're happy to answer any questions, and representatives from CPARB and DES are also available to answer questions.
So let's have them give their remarks really quickly, and then we do have to do a motion to approve this final report. But we have Rebecca, the chair of CPARB, and then I think Bill from Facility Professional Services from DES. Oh, I see Rebecca.
Senator Mullet, I don't think Bill.
Just Rebecca. Okay.
Yeah, just at this point, it's Rebecca.
Go ahead, Rebecca.
Well, good morning or afternoon, everyone. Thank you so much for having me here. I really don't have, I guess the main thing I could add that may be of interest to the committee would be to address the finding. CPARB has really spent a lot of time looking at its capacity to collect what I'll call quantitative data as opposed to qualitative data. We're really good at collecting qualitative information, taking stakeholder input and feedback, and using our PRC process to get a lot of objective project information and owner readiness information with respect to public works, alternative public works. With the job order contracting, what we've realized is that we don't really do anything with the job order contracting information. What the statute directs us to collect is data that talks about the number of job order contract projects used. And what we've realized is that public bodies retain that information and can make it available to the public, and that's where we focused our efforts. So we are addressing that finding by recommending to the legislature that they change the statute to require public bodies to maintain the data and make it available upon request, rather than trying to run it through CPARB. With that, I think I'm can speak on behalf of CPARB and its stakeholders that we believe it is very critical and urgent to have the statute reauthorized in this session, and we really appreciate your consideration, and I'm happy to answer any questions.
Senator Short.
Thank you, Mr. Chair. And I know it is either you, Rebecca, or DES seeking agency request legislation so that we can continue to allow this work to be to go forward?
Thank you. That's a great question. CPARB started a process almost a year and a half ago of working with our stakeholders and holding meetings to work on what would be the terms of a reauthorization bill. We did a very comprehensive overview of the GCCM statute, and we anticipate at the December 9th meeting that CPARB will approve a draft of the statute that would reauthorize it, and we've been working with the code revisor to put together a Z bill, and we've been working with DES as lobbyists to get sponsors for the bill, and working with our own legislative representatives on CPARB, including Senator Hasagawa, who we really appreciate. He has been a very active and engaged member, and we really appreciate his feedback, which I think has been helping us improve our focus on diversity considerations in the bill. And so we are definitely working on having that bill ready to go this month.
Representative Paulette, do you have a question too? You put your hand down.
Senator Short asked most of it, but I just want to recognize that Senator Taco devoted a great deal of time, along with the House Local Government Committee, to procurement reform, and we very much want to make sure that CPARB is reauthorized and closely relates to an agenda for which we're very grateful for the Senator's work. Thanks.
Thank you, Senator Taco. Senator Hasagawa, I see your hand is raised.
Yeah, thanks, Mr. Chair. This is a question for JLARC staff. Did you do any kind of demographic or racial equity analysis on in the course of your work? And if not, do you require statutory mandate to do that, or can you do that on your own?
Keenan, you want to take that one? Or
Yeah, please, Aaron, jump into if there's something else to add as well. I don't think we had access to enough information to do an analysis like that in the data that was available to us. We can attempt all kinds of questions, obviously at the legislature's discretion. So if either we are directed to look into an issue like that, or as we regularly do with we bring proposed study questions for future studies in front of the JLARC committee. If there are issues like that that you want us to look into, we can consider where we can add those as well. The other resource that obviously might be available to you, Senator, to look into that is the Office of Minority and Women Business Enterprises, and whether they can interface any of their information with DES to give you some insight into that. I know the director of OMWBE sits on the CPARB committee, so I think she's pretty in tune to the activities of the board as well.
Excellent.
Yeah, I'll just add on very quickly.
Go ahead, Aaron.
I was going to say quickly, there was a statutory change in 2019 that requested that public bodies start collecting information on the award process in order to promote diversity and inclusion. But that has been implemented in the more recent projects, and so that information was not yet available. However, that information will be available for review in the future by CPARB or other entities.
Okay. Well, and I think before we call the roll and ask for a motion, obviously, I think this is one of the most important things JLARC does is when we find something that we know is working, it's kind of the job of the 16 members of this committee to make sure the bill gets to the finish line. So I think, Rebecca, please keep us posted, I think, on Senator Short and Representative Paulette's question around, we need to know where the bill's at, who's going to be the sponsors. I think members of JLARC, I think our goal this session is not to have companion bills. If possible, just pick the chamber that's going to run the bill. And I think the work we do now between today and January 11th will be important to make sure a bill like this that I think is going to have broad bipartisan support gets to the finish line as early as possible in what's going to be a challenging virtual session. We want to make sure this one doesn't become a victim of our getting used to passing bills via Zoom and Teams. So Senator Short, do you have a last question before we ask for a motion, or do you want to make a motion?
I do. I think, Rebecca, too, I echo what the good chair's comments, and I would just say, for those of us that know the issue well and are going to educate others, I think it's important to know if there are any substantial changes to, just on whether it's the job order contracting or other provisions. I think it would be very helpful to know how that law is currently and what the proposed bill is. I think that will aid us a great deal in educating other members.
May I respond, or is there not time?
Quick response, please.
Quick response. Thank you so much. Working on a one-pager for you. Appreciate how difficult your job is going to be in this session. Thank you.
Okay, and with that, I entertain a motion to approve distribution for alternative public works contracting procedures sunset review proposed final report.
So moved, Mr. Chair.
Okay. Been a move, and we'll make one of those the second since it was moved multiple times. And
count me as the second. That's fine.
Okay. And with that, we'll have staff call the roll. I'm going to run to the bathroom while you do this, so please count this as my yes vote. I'm voting yes.
We'll do.
I'll be right.
Before you leave for the restroom, can I speak to the motion?
Mr. Chair, if you need to step away, I can take over the meeting.
Okay, yeah, and Senator House, go ahead and speak, and Representative Arcott, yes, please continue. I'll be back in 30 seconds.
Yeah, thanks, Mr. Chair. Yeah, CPAR has been doing a lot of great work, and it's working very hard to address this whole question of racial equity and access to public contracting opportunities. And as you know, that the whole process lends toward, it's kind of a prime example of institutionalized racism within our system, because as the contracts grow bigger and bigger, smaller minority-owned businesses have less and less chance to be able to compete in that larger arena because they don't have the adequate resources or whatever. So we've been working hard to try and figure that out, and I'll vote to approve the recommendation of the JLARC, but I think that there's a big gap in the recommendation on how it can serve to, or how it should have made recommendations on how CPAR can actually improve its process of inclusion. So I just wanted to make that comment before I voted on it. Thank you, Mr. Chair.
Okay, thank you very much. Okay, staff.
Okay, this roll call is on the motion to approve for distribution the Alternative Public Works Contracting Procedure Sunset Review proposed final report. Representative Fye is absent. Representative Frame.
Aye.
Representative Hasagawa.
Aye.
Representative Hoff is absent. Representative Kilduff.
Aye.
Representative Kraft. Representative Kraft.
Representative Kraft had to leave the meeting, so she's not present.
Excuse me. Senator Mullet, you said aye already. Representative Orcutt.
Aye.
Representative Paulette.
Aye.
Senator Saldana.
Aye.
Senator Short.
Aye.
Representative Stokesbury is absent. Senator Tackle.
Aye.
Senator Wagner.
Aye.
Senator Wilson.
Aye.
There's 1, 2, 3, 4, 5, 6, 7, 8, 11 ayes and 0 nays. So the motion carries.
Okay. Thank you very much. So that is approved, and we will now move to tax performance reviews, which is obviously kind of one of the important things we cover in this committee every year. And so we have JLARC staff with, I think it's Eric, Dana, Rachel, and Scott. We can see your report.
Good afternoon, Mr. Chair, members of the committee. My name is Eric Thomas, staff to JLARC. With me are my colleagues Scott Hancock, Dana Lynn, and Rachel Murata, and we are presenting the proposed final report for JLARC's 2020 tax preference performance reviews, in which the legislative auditor identified 4 preferences for further legislative review, including 2 not achieving stated objectives and 2 for industries that have changed since the preference's inception. You'll recall that you last heard this in July, and today's focus will be on the comments of the Citizen Commission. The legislature created the Citizen Commission for the performance measurement of tax preferences, which consists of 5 members, 1 appointed by each of the 4 caucuses and 1 appointed by the governor's office. The commission is responsible for sequencing the 10-year review schedule that JLARC staff takes on, and also takes public testimony, which is unlike JLARC's other reports, and they did this in September, and based on that testimony and JLARC staff work, adopt comments, which they did in October. This year, the commission endorsed 7 of the 8 legislative auditor recommendations, and we're going to focus on 4 of those today, in which there were significant comments to discuss. That includes customized training, unemployed veterans, farm worker housing, and microbrewers. With that, I will turn it over to my colleague, Dana Lynn.
Good morning, everyone, or good afternoon, excuse me. We'll start off with the preference review for a B&O tax credit provided for businesses that provide customized training programs for their employees. This was originally enacted in 2006 and is scheduled to expire this coming July 2021. The estimated beneficiary savings for the current biennium is just over $125,000. And the legislative auditor concluded that the customized training credit is not attracting new businesses and is unlikely to contribute to business retention. The legislature should allow the credit to expire. Funding could be redirected to other programs if there's an interest in maintaining support for customized training. This particular program provides businesses with a 50% B&O tax credit for each repayment that they make to the State Board for Community and Technical Colleges for contracted customized training programs that they provide. Very briefly, how it works is the businesses partner with local technical or vocational or community colleges, and they set up training programs to provide to their employees, and then they apply to the State Board. If the State Board approves the training, then the State Board pays the full training cost to the appropriate school from a revolving fund. Once the training is concluded, the business repays the State Board immediately for 25% of the training costs. And over the ensuing 18 months, they repay the remaining 75% of the training costs. And it's those repayments that the business earns the 50% B&O tax credit on. Those repayments are deposited by the State Board back into the revolving fund to fund future training. We found that the credit has not achieved the stated objective, which was to attract and retain new and expanding businesses. Our examination found that of the 61 businesses that had used the credit, 81% of them had been in business in Washington for over 10 years, and this was supposed to be directed at new businesses. 69% of the users had over 50 employees, and the law does state that preference should be given to small businesses with under 50. And finally, the preference was valued at 8/1000ths of all the business's gross income. At that rate, it was unlikely to factor into business location decisions. The legislative auditor recommends the legislature allow the credit to expire as scheduled this July. He noted that the B&O tax credit isn't achieving the stated objective to attract and retain businesses to Washington, and noted the legislature should consider repealing the associated customized training program. We note that we didn't evaluate the educational or the workforce development outcomes of that program, and those could provide other benefits to businesses and employees. The legislative auditor also notes that if the legislature wants to retain funding for customized training for policy purposes, it could redirect the money from the revolving fund to other existing training programs. In response, the Citizen Commission did not endorse the legislative auditor's recommendation. And to summarize their comment, they noted that the testimony they received suggested that CTP had several advantages over existing programs. Among them was that it was more likely to be used by existing small businesses who are not easily able to send their employees off-site for training or who can't readily handle the complex grant programming program reporting.
One second, can you pause for 1 second? Senator Short, did you have a question?
I do. Thank you, Mr. Chair. I'm wondering, back where you talked about, I think it might have been slide 6, it was either 7 or 6, I apologize. No, it was actually, so I understand, I guess my question is, the B&O, must have been slide 7, sorry. There are educational components, you mentioned those, but I'm assuming those aren't part of the original legislation that allowed the B&O tax credit?
The credit was included in the bill that did enact the customized training program. So the program is said itself, the credit is part of that. We didn't evaluate the how well the program has done for businesses. because we are targeted with looking at the tax preferences and looking to see if it actually had achieved its stated goal of bringing in new businesses or maintaining businesses. So that's what we focused on. We didn't look at how well the customized training program had actually worked for businesses in and of itself. Does that answer your question, Senator?
It does. Mr. Chair, I don't know if it's the appropriate time to comment, but at some point, I'm wondering if we're missing a component by not really addressing the educational workforce development, especially given the challenges that a lot of our young people and young adults are having in terms of work opportunities. I'm wondering if this might be something where maybe we need to redirect.
And I think Grant Forsyth can direct that when Grant makes his comments to the committee. I think Grant, who runs the Citizens Commission and does an excellent job, I will say, having sat in on those meetings. Yeah, he can make a comment, I think, to that. Senator Wagner, do you have a question? Senator Wagner?
I did, but it was along the same line, so I'll just wait and see what the program manager has to say.
Yeah, and if I could just quickly comment, Senator Mullet, the educational outcomes were not in the tax performance statement.
Right. Mm-hmm.
Just to conclude our comment, providing information to you on the Citizen Commission comment, they did note that the legislature should continue the CTP program, but to provide a stated objective that focuses on recruiting, retaining, and expanding existing small businesses. The next preference that we'll cover are actually two preferences, a B&O tax and a public utility tax credit, and that are provided to businesses that hire unemployed veterans. This was enacted in 2015 and is scheduled to expire July 1st, 2023. And the estimated savings in the upcoming biennium is just over $150,000. The legislative auditor concluded the preferences have had limited use and the legislature's goal of reducing the number of unemployed veterans hasn't been met. The legislature should modify the preferences to better serve unemployed veterans. These two preferences provide up to $1,500 in either B&O or public utility tax credit to businesses that hire unemployed veterans. The stated objective for both the credits was to encourage businesses to hire and create jobs for unemployed veterans. And the legislature did state a specific goal at the time it passed these. That was to reduce the number of unemployed veterans by 30%. We note that the legislature didn't designate any particular agency to actively promote the credits. We found that neither the objective nor the 30% reduction goal has been met. As of the conclusion of our study, December 2019, we found 132 veterans had been hired by 45 businesses. And we note that if all of those veterans had been hired because of the preferences, because of the credits, then the preferences would have reduced the total number of unemployed veterans by 1%. In addition, we found that the number of unemployed veterans has actually increased in the state by 20% since 2015 when this was enacted. The goal, as you recall, was to reduce it by 30%. Based on that, the legislative auditor recommends the legislature should modify the preferences to better serve veterans that are seeking jobs. Some of the options could include designating a particular agency to actively promote the credits, focusing on a subset of veterans or businesses, or redirecting resources to other state-funded veteran employment programs. And I'll pause here for a moment to see if there are any questions before I hand it over to my colleague, Scott.
Representative Kilduff?
Yes, thank you, Mr. Chair. Thank you, Dana, for the presentation. So currently there's a comparable federal tax credit for unemployed veterans that ESD administers, correct?
Correct.
And so an ESD also, they're in charge of the Yes Vets campaign sponsored by Representative Mossbrucker that followed the year we enacted this particular credit that's under discussion. So presumably that agency, that they're doing the campaign around employment, administering the federal piece, that would be a pretty natural alliance to have them potentially help raise awareness around this opportunity for employers as well as DVA.
Yeah. Correct. We talked with them. They do provide some information, but they haven't been directed to really provide an active role. We did ask ESD and the Department of Veterans Affairs. We worked with them throughout the study and asked them if they would like to comment on this, and they did not do so. I do need to, I forgot, I've got one more slide to go here. And that is the Citizen Commission's comment, which basically endorsed the legislative auditor recommendation and said the legislature should re-examine and modify the preferences and should consult with ESD and Veterans Affairs Representative Kilduff, as they regularly do as veterans in seeking employment. I apologize for that.
Senator Hasagawa, you had your hand raised. Did you still have a question?
Sorry, it was for the last presenter, so I'll pass on it. Thanks.
Okay, I'm sorry if I missed you, Bob. Sorry.
Okay, with that, I'll hand it over to my colleague, Scott.
Hello again, members. Now I'll speak to you about the review we did of the microbrewers tax preference. This preference was enacted in 1993 and has no expiration date. We estimated $7.2 million in beneficiary savings in the coming biennium. The legislative auditor's conclusion is that the preference created an estimated 2 to 6 jobs in the beverage manufacturing industry. Distributors receive 84% of direct preference savings, which amounts to 0.17% of their gross income. The preference on net provides a $3.30 beer tax exemption per barrel for each of the first 60,000 barrels sold by breweries that produce under 2 million barrels per year. Because the statute assesses the beer tax on both breweries and distributors, the preference can be used by both breweries or by distributors. We found that the inferred objective of the preference is to provide tax relief to Washington's microbreweries as the brewing industry developed. The beneficiary savings are $3.30 per barrel, and that comes out to 1 cent per 12-ounce can. The beer industry has changed since the preference was passed in 1993. By 2003, larger breweries had left the state. Annual statewide production dropped from 7.6 million barrels in 2001 to less than 300,000 barrels in 2005. A little bit about Washington's breweries. Most of Washington's 472 breweries are small. 72% of them produce fewer than 500 barrels per year. And most production in the state occurs at the 6% of breweries that produce over 5,000 barrels per year. As I mentioned earlier, both breweries and distributors can make use of the tax preference. In fiscal year 2019, 84% of the beneficiary savings from the preference were directly realized by distributors. We were able to determine that these savings amounted to approximately 0.17% of distributors' gross income. The remaining 16% was realized by Washington breweries that self-distribute or sell directly to customers, such as in a brew pub setting. And the 84% of all beneficiary savings that distributors were able to directly realize were split between purchases of beer from Washington breweries and purchases of beer from out-of-state breweries. We used an economic modeling tool to estimate the effect of the tax preference. We modeled a scenario in which the incidence of the beer tax fell on customers and another scenario where the incidence fell on beer producers. That work suggests that the preference directly supported between 2 to 6 jobs in the beverage manufacturing industry. The tax preference was also estimated to have resulted in a loss of 25 to 27 public sector jobs. And this estimate is due to government spending that did not occur due to reduced beer tax revenue. So this estimate is a result of presuming the entirety of the foregone tax revenue would have been spent under state government spending as it currently happens. This brings me to the legislative auditor's recommendation. The legislature should review and clarify the beer tax preference. The preference should be clarified to include a performance statement regarding the policy objectives of the preference. It should provide metrics to measure if those objectives are met, state the intended beneficiaries of the preference, and ensure that the preference directly targets those businesses. The Citizen Commission endorsed this recommendation with a comment. The Commission stated that the legislature should speak with both distributors and brewers to better understand their business relationship and how the differences in tax policy between Washington and Oregon impacts beer distribution and sales in Washington. The aim of this discussion would be to clarify potential changes to the preference that ensure it stays within certain federal constitutional requirements on taxation. And I'm happy to answer any questions, or I can proceed along to Rachel.
You can go to Rachel, and I'll just remind members of the committee, just as listen to some of the questions. When you vote to distribute these reports, you're not taking a position that says you agree with what's in the reports. That's kind of clarified when we distribute them. You're just making a motion or voting to distribute the report so it can be seen and it's out there, sort of thing. Just so everyone's aware that voting to distribute does not mean you're necessarily endorsing what's in the preferences. But go ahead, Rachel, you can go.
Thank you. Good afternoon. So the last preference we'll be discussing is a sales and use tax exemption for farm worker housing. This exemption does not have an expiration date, and we estimate the beneficiary savings will be about $3.4 million in the next biennium. The legislative auditor concluded that this exemption may have incentivized construction of some types of farm worker housing, and that the exemption's requirements may not align with other current housing practices. This exemption applies to both permanent and seasonal housing. Permanent housing is generally used by local workers who live in the same place year-round, whereas seasonal housing is typically used by non-local workers who come temporarily from other regions for work. It's often built to a simplified building code and licensed and inspected by the State Department of Health. We found that the new housing that's been created is unlikely to have eliminated the shortage. So this exemption was created in 1996 with the goal of incentivizing building housing to eliminate a shortage that was estimated for about 57,000 farm workers at the time. Since that time, housing has been built and agricultural employment has increased. The 2019 legislature funded a new report to estimate the size of the gap of housing for workers. The authors of that report presented a draft version just last week to the House Committee on Housing, Community Development, and Veterans. And that report estimates the shortage exists for about 102,000 workers. We found that of the housing that has been created, 84% of the seasonal housing was built in connection with a federal visa program that requires employers to provide housing to their employees. So that portion of the housing was not likely to be caused by this exemption. The rest of the seasonal housing and the permanent housing may have been incentivized to some extent. The requirements for using this exemption may not align with current housing practices and other funding sources. For instance, this exemption requires housing to be used exclusively for farm workers. Housing providers told us that their housing is often built combining farm workers with other populations like large families, veterans, and folks with disabilities. We also found that the definition for this exemption of farm worker differs from that of other funding sources, such as the Washington State Housing Finance Commission and the Housing Trust Fund. The result of this is that housing can be built that qualifies for other state funding, but may not qualify for this exemption. So the legislative auditor recommended that the legislature clarify this preference by adding a performance statement and by determining if it should be aligned with other funding sources or may be maintained in its current form. The Citizen Commission endorsed that recommendation and further noted that they received testimony suggesting the preference improves the financial viability of housing, therefore helping to increase the supply of housing. They also noted that it could be improved by aligning it with other funding source requirements. And they noted that they received written testimony from housing providers that offered several specific changes that could be made to the preference that they would like the legislature to review. Additional tax preference reviews this year. These are all preferences where the legislative auditor recommended the legislature continue the preference and the Citizen Commission endorsed that recommendation.
Senator Solano.
Thank you, Mr. Chair. So just one question in terms of the specific recommendations that were provided in that testimony. Were those written testimonies that were submitted to all of us, or is that on the JLARC website for review?
Yes, that was submitted to the Citizen Commission and it is available on the Citizen Commission website, and I'd be also happy to send it to you.
Thank you, because I am working with, just for a note, if it's okay, Mr. Chair, but I am working with Representative Ryu and would like to engage with anyone here in JLARC in terms of trying to take some of these recommendations, particularly around aligning definitions and making sure. It's alarming to me that we've doubled the need in the time when we had initially put this forward. So looking to for opportunities to kind of tighten and focus this program to get to the real need for farm worker housing.
Okay. Rachel, are you, or are we?
Yeah, only Scott, oh, there we go. I'm sorry. Yep, the only slide left was our contact information. That concludes our remarks, and we're happy to answer any other questions.
Okay, any other questions for staff? I think we're Grant. Grant, I see you. You're there. Nice. Gaylord, meet Grant.
Well, I promise to be brief, Chair Mullet. And again, just for the record, my name is Grant Forsyth. I'm the Chief Economist of Avista Utilities and the Chair of the Citizen Commission for Tax Preferences. Just very briefly, let me talk about the customized training, which is where we differed with staff. It was the only preference where we differed substantially from staff recommendations. And it really was because of testimony from people who have used this particular preference. And what we saw was potentially a lot of value for workforce training outside of the original intent of the tax preference. And in particular, for smaller businesses, it was pretty clear from people who had either worked with businesses or administrated it for businesses, the structure of this really fits what they need for workforce training. The other issue that came up was, of course, the issue of workforce training, the high demand for it because of COVID. And so maybe this program offers some chances for that kind of workforce training for smaller businesses, again, outside of that original intent, which may not be appropriate for what this preference can maybe do. So with that, let me just open it up to any other questions.
And I will say to the members of the committee, if you ever sit in on a citizen's preference hearing, Grant does an amazing job and they get into the weeds of these preferences like you would not believe. It's very impressive. And it's all people just donating their time for public service. It's a really great group. Yes. Are there questions for Grant before we move on to, I think Representative Paulette had a proposed committee addendum.
I think Senator Short has a question. So
Senator Short, go ahead.
Thank you, Mr. Chair. I appreciate it. And Graham, thanks so much for what you do. If we were able to just change that tax preference to include, the workforce training components, I mean, is that something that you think would deserve support if that got changed from, or there was additional things added to that original tax preference?
Yeah, I mean, I think really with this particular preference, the emphasis should be on looking at workforce training rather than trying to retain or recruit a lot of businesses to the state. Because I just don't think, I mean, let me put it this way, I don't think that intent is really appropriate for the value that this program has. I would say that. And if I can just say briefly too, on the farm worker housing issue, we spent quite a bit of time talking about that. In particular, I had to spend a lot of time talking about it, and it is worthwhile to look at this issue again for you folks. What I discovered is the whole issue of farm worker housing, how it's financed in these different programs, is actually incredibly complicated. And so it would be worth your time to sit down and again, look at all these programs and how you might realign the current one with what's already out there. But again, there's value there in terms of supporting workforce housing for farm workers.
Thank you very much, Grant, and really grateful for your public service. Thank you very much.
My pleasure.
Okay, so with that, Representative Paulette, did you want to speak to your proposed committee addendum on farm workers?
Yes. So I don't know.
That's in order, correct, Keenan? Is the next item?
Do I need to make a motion or is it on the table?
I think you would need to make a motion.
Mr. Chair, I'd like to move consideration of the proposed committee comment on farm worker housing.
There's a motion. Is there a second?
Senator, do you need the staff to pull that up? Would that help you or the committee members, or are people already?
That'd be helpful. You may have a shared screen coming.
There we go.
Can't tell.
And you might need to try to zoom in a little bit, Geneva. I think looks a little small on some of the screens. Yeah, as much as you can blow it up. Is that better, Representative Paulette?
Oh yeah, that's as good as on my own screen. Thank you.
You can scroll down just a little so they can see the underline.
So the motion is to add a comment to the report, and the nutshell is this, that the legislative auditor's report found that at least 84% of the housing built is already required housing under the federal H-2A visa program, which brings in foreign workers under contract for a very short period of time, and quote, and likely would have been built without the exemption, unquote. The amount of money that we're talking about is about more than 2/3 of the total amount of money dedicated to farm worker housing to meet the other needs that you heard about for over 100,000 farm worker and family members who are migrants or permanent year-round residents of Washington in the Housing Trust Fund. So in essence, we're providing $3-point-some-odd million to a tax credit for foreign visa workers for housing that would have been built by the growers anyway to meet the requirements of the visa program, which are heavily incentivized at this point in time for them to bring in foreign workers, and not using that money to meet a crying, desperate need for community-based housing for migrant and year-round farm worker families in Washington state, and also to provide support for the Department of Health's inspection program. So the recommendation, that the comment I am suggesting in here with the co-sponsors is that the legislature, I pulled up the wrong thing here, that the legislature, the committee comment that while the legislature is certainly going to be searching for resources to meet that need for farm worker housing, redirecting these funds, the tax expenditure, in addition to the current funding level in the capital budget, would be very supportive of meeting the defined need. I'll stop there.
Mr. Chair, I would just raise a point of order at this point.
Representative Scott, go ahead.
Thank you. The motion was made and there's been ample time for a second and there was no second. I wonder if this motion dies for a lack of second.
I'll second it.
Seconded by Representative Gillette. Are there any other comments on this motion?
Mr. Chair.
Representative Orcutt.
Thank you, Mr. Chair. I would propose that we not adopt this amendment. One, we just heard from Mr. Forsyth that this is something that we should be looking at and trying to align. This says to repeal. So I think that contradicts what we just heard as a recommendation from Mr. Forsyth. And I would also raise concern that, you know, JLARC is intended to be a bipartisan organization. And until this was posted on the JLARC site or distributed to members, I know I wasn't approached, and I don't know if any other Republicans were approached. And I see that it's only Democrats that are sponsoring it. So I really wonder if this is going to end up being a partisan issue rather than being bipartisan, which has been what JLARC has prided itself in for many, many years. I would really prefer that the sponsor and the seconder of the motion would just withdraw and that we not advance this. But otherwise, I would ask for members to vote no and try to remain partisan or nonpartisan in the way we move forward, and maybe not be quite so prescriptive.
And I'll say I appreciate Representative Paulette bringing it forward, but I will say as a member of the executive committee for the last, I don't know, long time, 5 or 6 years, we did have a recommendation from the executive committee that all proposed addendums have sponsors from both political parties. I mean, that was a goal. I think when we spoke to the audit people who ranked JLARC so highly, I think the fact that we've tried to stay as nonpartisan as possible is one of the reasons this is viewed as one of the best organizations in the country. And so I think in the attempt to keep that spirit of JLARC, I feel like we should be focusing on addendums that have bipartisan sponsorship in that realm. But I think with staff, I guess we'll call a roll call of the votes. Marilyn?
Mr. Chair, I'd like to respond for a second.
Oh, okay. Well, Senator Wagner and then Representative Paulette.
Okay, thank you.
Thank you, Mr. Chair. I'm agreeing with Representative Orcutt, but I take a slightly different tact on it. I guess I say sometimes I don't fully understand all the implications if I don't study an issue a little bit, so I can better understand, you know, maybe the primary and secondary and tertiary effects in a first reading of an amendment that I have not really had much exposure to until now. So I may be for this in the long run, but right now it's a bit of a surprise to me, and I don't want to make a decision that bites any of us, so I'll be voting no.
Representative Paulette, do you want to make?
Thank you. Some of the members, a few, not the majority obviously, have been involved in what is indeed a deep dive into the dire need for farm worker housing and priorities in the state of Washington. It is not a partisan issue, but viewing and having a discussion about a proposed comment about whether or not the finding of the auditor leads committee members to make a recommendation that in fact we support the finding and go beyond that and say in that case we should reprioritize the funding is, I think, an important role of the committee members as opposed to the legislative auditor, whose job is not to make that type of recommendation, but it is the job of members. And this is a case where we know that the legislature's commissioner report on farm worker housing, you just heard the results of it, it is a dire, dire need. And you have a report in front of you that says this is not meeting the goal. And therefore I'd ask for a yes vote.
Okay, staff can call the roll, please.
This roll call is on the motion to approve the proposed addendum to the Farm Workers Housing Tax Preference Review. Representative Fye, I believe, is absent. Representative Frame.
Aye.
Senator Hasegawa.
Aye.
Representative Hoff, I believe, is absent. Representative Kilduff.
Aye.
Representative Kraft, I believe, is absent. Senator Mullet,
No.
Representative Orcutt,
No.
Representative Paulette,
Aye.
Senator Saldana,
No.
Senator Short,
No.
Representative Stokesbury, I believe, is absent. Senator Taco,
No.
Senator Wagoner,
Wagoner votes no.
Senator Wilson, is Senator Wilson present?
No.
So there are 4 ayes and 6 nays. The nays have it and the motion fails.
A motion is in order to approve for distribution the 2020 tax preference performance reviews proposed final report. And I will repeat, I think what Keenan has done a good job highlighting is your motion to, approve for distribution does not mean you're endorsing what's inside each individual tax preference outcome. You're just endorsing the idea of it being distributed. And so could staff please call the roll?
This roll call vote is for the motion to approve for distribution the 2020 tax preference performance review proposed final report. Representative.
Mr. Chair, do we have a formal motion made? If not, I make a motion.
A motion by Representative Orcutt. Thank you, Representative Orcutt. Good catch.
Second.
There's been a second. User error by the chair.
Okay, so this motion is to approve for distribution the 2020 tax preference performance reviews of the proposed final report. Representative Fye, I believe, is absent. Representative Frame.
Aye.
Senator Hasegawa.
Aye.
Representative Hoff is absent. Representative Kilduff.
Aye.
Representative Kraft, I believe, is still absent. Senator Mullet.
Aye.
Representative Orcutt.
Aye.
Representative Paulette.
Aye.
Senator Saldana.
Aye.
Senator Short.
Aye.
Representative Stokesbury is absent. Senator Taco.
Aye.
Senator Wagoner.
Wagoner votes aye.
Senator Wilson.
Aye.
So there are 10 ayes and 0 nays, so the motion carries.
Okay, thank you very much. And that Keenan, do you have any closing comments before?
Just one brief note. There was on the agenda some proposed study questions. Again, you'll recall these are documents we put out for studies that we are working on to be released in the future. In the spirit of we have no time, I just want to announce that they are available and we will have them posted to our website. If any of you would like any information or a briefing about the document and the questions we're going to entertain, please just get in touch with me. We'll set something up. There are 2 future tax preference reviews, a B&O tax exemption related to medical marijuana, a series of tax preferences for medical marijuana, and a B&O tax preference related to the health benefit exchange.
Okay, thank you very much. And we'll conclude our meeting. We'll conclude JLARC for the year. I'd like to thank staff for an excellent job this year. And I think Representative Kilduff and Senator Taco, this could be is this your last JLARC meeting? I would like to sincerely, from the bottom of my heart, thank you both for your incredible public service. I genuinely
Thank you.
You're both going to really be missed on this committee. So.
And I'll miss you guys too.
Same here.
And Dean, once our bars are open, Senator Taco, I'm driving down to your neck of the woods for a beer.
Don't forget
I just want to get a clarification from Keenan. We have a JLARC meeting in January, correct?
Yes.
So Senator Taco and Representative Kilduff would still be members at that time.
Yeah. They are, of course, completely at their discretion. That will be before the end of their terms. If they want to participate, by all means, we would
please come
love
back.
to have them.
Gosh, Representative Orcutt, another good chair correction. I appreciate it. I got sentimental 1 month too early. Okay. Hey, thank you very much, everybody. I really appreciate it. And I hope everyone has a really good holiday, and we'll see everyone in 2021.
Bye.
Bye-bye.
Bye.
Oh, with that, we're gabbling out.